I only have a, I only have a few slides. I won't bore you too much with content. Um, just to have a quick introduction about what we're doing today. So, welcome to our This for Social Good and WHO presentation. Today is the 6th of June. So I'm super thrilled to have that project wrapping up again, because there was an amazing project, both from volunteers side, but also from the WHO team. They've been so responsive. They've been so willing to share their knowledge. It was a hard topic, hard data set, and then they were very generous with their time, helping the volunteers. And I think that was amazing. I don't know what other people think, but I thought just big clap for the WHO team and then Piotr and the team. That's amazing. Just to cover the basic, the agenda is not very fixed. We're quite flexible, but the idea was to have the WHO team doing a bit of a awareness session to start with. There were a bit of confusion between conditions and disabilities, and then the team really wants to make sure that we get that kind of content and that message. So I think that we thought was very useful for the team to start with that. Then we had the idea to have a bit of a panel discussion with the 5 volunteers before or after the presentation. So I think I'm guided by the team, but by you, Piotr, if you want to do the panel before or after, it doesn't matter too much. Then we have the 5 volunteers showcasing their work, more that later, and then some feedback, and then we're sort of wrapping up with showing you the This for Social Good tracker, and then announcing the next project. Very briefly, we got 49 submissions. So I think in terms of a project, that was one of the most successful projects. There's a link somewhere there. If someone has the link, I can put the link as well in the chat, but the link was also posted in the Slack. Very high quality content, and I'm sure Piotr and the team can attest. Amazing content, amazing data viz, amazing project report. What I thought was interesting is there's always a lot of first-timers and beginners. So it just proved that this was good is really for all levels, all skills, and all tools. There's a lot of Tableau folks doing that kind of project, but there's amazing breadth and depth of other projects as well. So the way it's going to work, obviously, I've said we've got the WHO team as guests, but our 5 stars, our 5 guests are C, Christina, Gabrielle, Helen, and Jessica. And I'm going to let Piotr from the WHO team expand on that, but those volunteers have been selected and reviewed. We had 49 submissions. I think 40, I think, but 50, I think I've seen one rate. But the process would be the follow. You'll have about 5 to 7 minutes each, sharing your screen, and you're basically going to tell us your story. And then depending if we do the panel before or after, Piotr will have a few questions to ask you, and basically it will be like a discussion. And then Q&As and feedback at the end. So there's no winners. I think we all winners. The volunteers are winners. WHO is winners because they've got 49 amazing submissions. I think that's my time in introducing the event. I'm gonna let Piotr and the team just expand a bit more and introduce themselves, and then we start from there. Piotr, over to you.
Yes. Do you see my screen?
Yes, we can see your screen.
Maybe you see too much, but I will fix. So, hello guys, welcome. My name is Piotr, and I would like to, together with WHO team, we evaluate. We also try to answer all your questions during the process of creation, the visualization. So, big applause for Celine, Kyla, and Dorothy for helping with that. First of all, I would say the ladies and gentlemen, I would like to extend my heartfelt congratulations to all participants of this amazing event. I will remain the name transforming data into accessibility visualization for positive change. And I'm seeing a lot dedication and expertise in the leveraging data to create very impactful visualization, which are commendable. And congrats, well done, and this is really good job. What I can say, I can extend that, and I will wish that your work continue to inspire others in their quest for a better world. I think this is the most important subject. As you can see, there is a top 5. I will hand over for Fredrik for the presentation. We will love to have, after a quick presentation, a little bit panel discussion, which will be run by Kylo and Dorothy. So we prepare a little bit a question to be inspired together, as I mentioned, for preparing the better world further. For all participants who stand properly work submission, so it seems that we are able to open it and judge and see what you did. And as Fredrik mentioned, all the submission were amazing, are amazing. So good job. So please expect the badge. You should have received a notification about the receiving that, but still there's also a reminder for the people who haven't sent the full name. Please do this, because on the badge you will receive also your full name, the first and last name. So if you haven't send it, or you are not sure which data are in the submission, please contact with Fredrik. And I will hand over to Kylo. I will be sharing screen, and Kylo give you a little bit inspiration talk about the disability and the health condition. So Kylo, if you could tell us and inspire us in this topic, please.
Thank you, Piotr. And I'm not sure I will be very inspiring, but I just wanted to share with you a couple of points that may help you, and you can take them as considerations if you want to, for example, continue working and creating visualizations on disability, or if you want to just improve the content of the ones that you have already created and make sure that the language and the content are appropriate and also aligned with the WHO narrative on disability. First of all, let me just say that we were really impressed, the whole team, with your designs. They really look great, and it's great that you've in such a short time you've created so many graphs and stories, actually, because I think the stories is what really inspired us and was really interesting to see how you translate the data, just a simple Excel file with data, and you translate it into a real story with visualizations. And just to say that in any case, whatever, so everything that I will share with you now in terms of disability, what disability is, and things that you may want to consider, this was not something that really was taken into account in terms of the evaluation of your designs. But as I said, it may be helpful for you to make sure that the content is appropriate. The first thing that I think is very important to consider is that disability does not equal a health condition. And in some of the designs that we saw, this was sort of reflected in the visualizations and in the description. But we just want to make sure that you know that disability is something much more complex than a health condition. So disability is a result of the interaction between a health condition that a person may have and the impact of the environment. So this can be environmental barriers like inaccessible infrastructure, hospitals, or attitude, negative attitudes, stigma and discrimination that exists in the society, or lack of accessible communication, for example, health communication, but also any other type of communication, or lack of educational opportunities or employment opportunities. So when we talk about health conditions like depression or vision impairment or hearing impairment, these are not disabilities. These are just health conditions which contribute to disability if the surrounding environment, environmental factors or barriers negatively impact a person's life. For example, if we talk about a person that has depression, this is not necessarily a person with a disability. However, if this person experiences stigmatization by his colleagues or peers or anyone in society, or if this person cannot find a job, for example, because of his depression, then we can talk about a person who has disability. And a second point that was also, we saw in some of the designs was some language that is not really considered appropriate and can be seen as stigmatizing or discriminatory language. For example, when we spoke about burden of disability, or when we spoke about a problem of disability or handicap, because we know that regardless of the health condition or impairment, persons with disabilities can actually enjoy healthy lives when the necessary action is taken to address the different factors that contribute to them experiencing disability, like stigma or disease risks or health system barriers. And it's actually interesting to know that many studies that have measured the level of quality of life of persons with disabilities shows that actually persons with disabilities have the same level of quality of life when they self-rate their quality of life as those without disabilities. So in terms of future projects that you may have, or if you want to change the designs that you have now, you may want to avoid these type of words or languages and just speak about persons with disabilities or the challenges that exist in the environment that lead to disability, and this kind of language that is more aligned with what the disability community accepts. And the third one, I will finish with this, is something that we also wanted to emphasize, and this is the fact that we normally do not speak about prevention of disability. We speak about prevention of health conditions or prevention of impairments, or, for example, prevention of environmental barriers, but we do not speak about prevention of disability, because normally prevention activities exist because we want to eliminate or to reduce the likelihood of something that existing because it is considered bad or negative. And as many people identify as being a person with disability, a focus on preventing disability feeds into negative stereotypes that having a disability is not a good thing. And many people identify themselves as persons with disabilities. And when we speak about prevention, is as if we wanted to prevent them from existing. So this is not really something that that is seen as appropriate when we speak about disability. So just make sure that you talk about preventing health conditions rather than preventing disability. So these were the sort of the three key content and language considerations that you may want to take into account. As I said, if you want to change what you have already created, or if you continue working in the field of creating visualizations on the topic of disability. And yeah, if you have any questions or anything that you want to know more about disability, please don't hesitate to contact me or someone from the team, and we'll be happy to answer. But I'll stop here and go back to you, Piotr.
Thank you. I can agree. Yeah. I would say that we can agree that that was very inspiring. And yes, I really encourage you, if you have still room for a little bit improvement, please and share it, because it's very important to follow, because as we mentioned, you did amazing job, and it's really worth to share this message for the world, because if the one person will take in account the data, it will be fantastic. Okay, yeah, I think there's okay. I don't know why the mic was automatically muted. Again, from the WHO perspective, I'd like to thank you, and again, let's your work to inspire others in the quest for the better world. So again, thank you, and I hand over to Fredrik, and let's start the presentation and the panel.
Thank you. So, and just for sake of transparency, the 5 volunteers that were selected were sent some very detailed feedback from the WHO team, and they've had time to address a couple of those minor things. But for people recording, that, as the team said, have a play the recording, and if there's things you can change in the language, I'm sure Piotr and then Caroline would be more happy to give you a hand as well and review your modified data viz. So in terms of next step, as I said, we'll have the 5 volunteers that are going to present their work. So in the order, but there's no reorders at C, Christina, Gabrielle, Helen, and Jessica. If one of you needs to jump in front of the queue and then present because you got other meetings, that order is not really thorough, so I just very random. But if you need to present sooner than later, let me know. But otherwise, I'll have C presenting first, and then the idea is to have 5 minutes each, so we've got time for the panel after. And then just share your screen, tell us your name, where you're calling from, and tell us your data story. And then I suspect the panel would address some of the feedback and comment. So we'll probably do back-to-back and then have the 5 volunteers presenting the screen back-to-back. So if no one's keen to present first, I'll get C to start the show. Thanks, C.
Yeah, sure. Is there anyone want to go first? Okay.
The one. Thank you.
Okay. Can you see my screen?
Yes, perfect.
Okay, thanks. Okay, so my name is Si Jian, and I am a UX designer. So this is the first time I attended an event hosted by Viz for Social Good, and thank you so much for providing such a great platform. Also, thanks to the WHO committee for selecting my submission. So I want to quickly introduce my tools, as I realized that I might be one of the very few participants using Figma as the primary tool for this project. So for those who are not familiar with it, Figma is a dominant tool in web design, mobile app design, or any other kind of digital product. So I use Tableau also to clean and visualize the data, then export the visualization to Adobe Illustrator and Figma for further post-processing. Especially in Figma, you can add like a highly customized graphical effects and interactions. So back to the project, as my project title says, my project focuses on the disparities in the prevalence of causes of disability by WHO region, which means that I use data viz as a cue to reveal the stories behind the data. So the first part illustrates a global view of health conditions that cause disability. So the figures show the overall prevalence of disability in all 6 WHO regions. A map is also shown here to help readers navigate to a specific region or country they are interested in, is not everyone is familiar with the WHO division. The next visualization shows the ranking of level 2 health conditions causing disability by WHO region. So the top 5 health conditions causing disability for each WHO region are highlighted so that the reader can easily understand which are the most prevalent. And then this visualization is quite similar to the previous one, but focuses on the level 3 health conditions causing disability. Okay, so next part. So the next part is about exploring the disparities. So this means by visualizing data and observing the data, we understand if a certain health condition causes a much higher rate of disability in a certain WHO region than in others. So there must be reasons behind this phenomenon, and those reasons could be identified as socioeconomic, environmental, cultural, or even more. So my goal is to uncover the stories behind the data by investigating and analyzing other sources like articles, reports, and data sets. So for example, let's move to probably this one. For example, the proportion of people with disabilities caused by substance use disorders in the Americas is about 220% higher than the average of the other 5 WHO regions. So why is that? By doing quick research, it may relate to less strict drug regulation or more prevalent drug abuse and overdose problems. But because of the limited time, this part of exploring the reasons remains kind of incomplete. So my expectation is, the stories behind that could also be visualized, like such as in comparison to other countries or regions of the world. So what differentiates drug control laws in American countries, and how it contributes to substance use disorders? I think it would be great if I can do further research and visualization, some of the research. So the final part is to keep the reader aware of the significance of understanding and comparing the prevalence of causes of disability in various regions. So a few points are mentioned here, including it helps policymakers and decision makers better allocate resources and determine the priority of interventions. It helps identify inequalities in healthcare services and resource distribution, and it helps raise public awareness about specific health issues and more. Yeah, that's all. Yeah, that was my part. Yeah, thank you.
Thanks, Yi. I could listen to you for hours. It's so beautiful. I know
Thanks.
we've got limited time. Amazing. I'm not sure people, if you look at the chat, people would that said thank you, congratulations. It's an amazing story. I think we're gonna keep the feedback to the end. Piotr, what do you reckon?
Yeah, I think we can just go through the presentation and then we can go with the panel. I think the feedback is like there's a beautiful visualization, and we saw like already top 5. So I would say we can skip this part to just have a more discussion and in deep understanding about some decision that a participant made during the work. So let's continue. I would like to invite the next person on the stage.
Okay, perfect. But see, well done. It's amazing. Christina, you're up next, if you don't mind. And tell us where you're calling from.
Yes.
I think you're from Republic Czech.
Okay, now I'm sharing my project.
Yes. Yeah, we can see the screen now.
Hello, everyone. My name is Christina. I am from Czech Republic, from Prague. I am a data analytics enthusiast. I'm sorry. I like to dive into that data and look for insights, especially in social. At the beginning of my presentation, I would like to thank the World Health Organization and WISPA Social Good for the opportunity to participate in this incredible project. I prepared a text of my presentation, and if you don't mind, I will be read. By my project, I wanted to show a data story about the life of people with disabilities. According to the data, every 6th person has a significant disability. My project is about is a message to all people to think about it and maybe do something to improve the lives of people with disabilities. There should be no boundaries for people with disabilities, such as inaccessible medical care, lack of opportunities for education or work, discrimination, and so on. I have been thinking a lot about how to present this data and make it more useful to large audience, so I decided to show only the key facts, dividing the information into smaller parts for easy understanding with simple charts without any filters, buttons, or interactive elements. Because if people can't use a mouse because of some health condition, they can go through the project only using one tab button. In my project, I only used 4 types of chart. For better understanding, I have added text labels to each chart, such as the name of the health condition, percentage, number of cases, frequency, name of regions. Under each chart, there is an explanation of how to read it. I used 2 contrasting colors for the charts where necessary. Many of the charts are in the one color, except for map. I read about color blindness and how to present a chart for people with this condition. If the map chart, in the map chart, I chose colors that are different from each other, and then I found a source that helped me test the map image with different vision. So the first page prepares people to dive into disability information. You can see general information about how many people have disabilities and the 5 known health conditions that lead to disabilities. The next part is about visible and invisible conditions that lead to disability. It is common to think that people with disabilities move around in a wheelchair, but many people have invisible health conditions that lead to disability, but because of confusion or shame, they don't want to talk about it or share it with others. So I decided to search the internet for information about all of cases of disorders that include data, regardless of whether each case is visible or invisible. And what I got, 77% invisible and 23% visible condition of health. Much more interesting is that the first place for invisible health condition is the musculoskeletal condition. The next point is the type of severity. Moderate severity prevails over severe severity. The first place in severe severity is a mental condition. Major depressive disorder and schizophrenia affect 27 and 24 million people. That's a lot. And don't forget that these are invisible health conditions. The next part is the congenital health conditions that lead to disability. Now we can say that disabilities affect not only adults, but also children. If we take a look at the first chart, we see a small percentage of congenital health conditions, but the 2% of 1.3 billion people is not small. The following chart shows to measure congenital health conditions. I'm not a medical professional, but perhaps some of these conditions can be anticipated and prevent a child from suffering in the future. The next part is about gender and age. The percentage difference in the prevalence of disability between women and men is small and increases with age, but in all groups, women prevail over men. If we talk about the regions, Europe and Americas are dominated by people with disabilities. 1 in 5 people has a disability compared to 6 to 8 in other regions. I found the frequency for each region using the percentage and number of people with disabilities. And the last part is about income and some hard-to-cure health conditions. We see that people with high incomes predominate. The next chart is in this part includes the 5 hard-to-cure health conditions. People still suffer from tuberculosis and HIV/AIDS, especially low-income people, and I'm not even talking about cancer. These conditions are like a sentence for a serious crime that people did not commit. I just wanted to show that no matter what income people have, unfortunately, disability can affect everyone. Thank you.
Thanks, Christina. Beautiful, beautiful design, beautiful storytelling.
Thank you.
Thanks a lot. Thanks for your time for presenting as well. Gabrielle, you next.
Hello. Let me share my screen. Everyone see that?
Yes, perfect.
Great. So just to get a little bit of background about myself, my name is Gabrielle, and I'm a researcher in computer science at Newcastle University in the UK. And I actually work with data from people with epilepsy. So I have some experience working with clinical data. And I'll talk a little bit about my tool here because I think I was the only person who used R. It's well known as a statistical programming language, but also has very nice data visualization packages that allow a lot of control over the specifics of the data visualization. And I've been working on learning that recently, so use this as a way to challenge myself. Also say this is my first time participating in Viz for Social Good. So it's a privilege to be chosen to present. And yeah, thank you very much to the organizers and the WHO team, because this has been a great experience. I decided this was a very rich data set. And I think a lot of the visualizations that we've seen have shown really cool ways to dive into those details. I decided to do more of a high-level overview and design a visualization that, with the goal of having a memorable way of visualizing some simple statistics that can hopefully have an impact and raise awareness of disability. And so the key message that I took away from the initial WHO's presentation on disability was that anyone can have a disability, and that was part of the infographic that we received as our package, that 1 in 6 people have a significant disability. So I chose to focus on that message. And one thing that I've seen in other visualizations that has really stuck with me is bringing these statistics back to the individual. So I decided to represent each person, or not each person, but every 1 million people with 1 dot, just to try to show the scale of disability. So in this first visualization here, this represents our global population, and the gray points are people without disability, and purple with disability. Just because, you know, the statistic 1.3 billion is such an incomprehensibly large number. So this is meant to be a little bit overwhelming because there are so many points. and decided to mix these points together to better represent the situation in the world, which is that people with and without disabilities live alongside each other. But then I did take out all the purple points, so it's easier to compare, because it is tricky to see that this is 1 and 6 when it's mixed together. So the areas of these are proportional to that statistic. And then I wanted to focus on the characteristics of people with disability and really emphasize that it's not one particular group that's prone to disability. This is very much, as the title says, anyone can have a disability. So I rearranged these points into stacked bar charts to show that people with disability can be male or female, they can be any age, and they also come from countries that have different economic situations. And this turns the original statistics on their head a little bit, because they're expressed as prevalence. So, as the previous presentation showed, what percentage of people who are 60+ years old have disability, and it is most common in that age group. But if you look at, of people with disability, what percentage are 60+ years old, that's actually not the predominant group. It's 15 to 59 years old, just because of population structure. So both are very important ways of looking at the data and understanding the data, but they answer different questions. And I wanted to emphasize the diversity within this group of people, so chose to present the data this way. And then I wanted to note that these factors all contribute to health inequities, and that's a takeaway that I took from the WHO's report. I can talk a little about accessibility too, but I think we're going to have a panel discussion on that, so I can save that for that part.
Thanks, Gabrielle. Beautiful design and stories, and I love the fact that you use our different software. So I think it's really beautiful. And yeah, we'll have a panel so you can cover those points in the panel. And that's to share. Amazing work. Thanks again.
Thank you.
Ellen is next. Ellen, sorry.
Yeah, share my screen.
Ellen.
Are you able to see everything?
Yeah, I can see your screen.
Okay, so firstly, I'm Ellen. I'm based in London and I'm a freelance information designer. Again, thanks for the opportunity for working on another Viz for Social Good project. It's an amazing organisation, one that I am very, very honoured to participate for, and it was a great cause this time around. So the piece that I wanted to do was, my project was all around centering the humanness in disability, kind of echoing what Gabrielle has just said, that 1.3 billion people is a really, really huge number. And I think that sometimes we can get lost in those numbers. So you'll see in a moment the way that I come about this project is I wanted to focus on the human stories, and ensuring that ultimately we're people at the end of the day, and anybody, as some of the statistics have shown, like 80% of all disabilities are invisible, so anybody could be living with a disability. So I wanted to do a project that was all about kind of leading with empathy, because you don't know what anybody's situation is. So first foremost, my project was built in Bev, something that I'd never used before, but I wanted to experiment with utilizing some form of scrolling form of telling a data story, because I thought it would be great to have a project that was approachable and wasn't bloated with kind of filters and having to click here and click there. I wanted something that was quite clean and very simple and easy to walk the user through. So the first piece is all about an introduction as to what disability is and what this project shows. And then I really wanted to focus on the accessibility side of this project. This was something that I learned a huge amount on with doing this project, and something that when I look at some of the other projects that I've done in the past, that I really need to go back to those projects and tighten up some of the colours that I've used and the way that I've displayed the data. So it was something that I called a lot of attention to So I wanted to create, you can see here, is there a couple of things that I've integrated within the project. I wanted to create a colorblind friendly palette because a lot of the work that I was doing was illustration based. So I wanted to create something that was really friendly, really vibrant and bold, and that people that were colorblind were able to interact with and get some form of enjoyment and joy from. And similarly, on the right-hand side, I'm aware that as data viz enthusiasts, that we are quite reliant on colour in a lot of the viz work that we do. And sometimes that may be the only thing that we use to signify something in a visualization. And this was a real learning curve, that it's not that colour is bad, but it's that colour needs to be used with something else. So it needs to be used with a label or pattern or shape and things like that. So that was something that I was also very conscious of. I'm going to quickly scroll through these pieces now because I'm aware of time, but high contrast as well was implemented, alt text for all of the images. As I was using a website builder, I was trying to ensure that all the text I was using had appropriate HTML tagging. And then the biggest learning curve was the piece on responsive design. So creating something on desktop is one thing, but then having that also work on a mobile or a tablet device was something that I was keen to implement as well. And as well, keyboard navigation. So for those that are unable to use a mouse, it was critical that they were able to tab through the visualization that was created. So onto the actual visualization itself. 1.3 billion, it's a huge number. And I really wanted to show kind of the scale of that number. And so what I have done here is I've created a scrolling infographic where each of these little people, these little icons, represent 1 million people. And so here you'll see 1,300 of those little people, which is a big number in itself. And you'll see that once you begin to scroll through that, I wanted the user to go on that journey of, oh, okay, this is a lot of scrolling. This is impactful. This is a lot of people that we're talking about here. And that's exactly what I'm kind of showing here. And this is where I kind of wanted to get on to the piece around bringing the humanity into the visualization. So 1.3 billion is 1 in 6 of us. And I wanted to think about that through the lens of, well, who do you interact with on a daily basis? When you're going into the office, you're maybe getting the bus and you've got a regular bus driver, or you're getting a coffee from a barista and you're meeting your work colleagues. These are all people that you interact with, but you don't necessarily know all of their life stories. So the key piece here is to treat whoever that you interact with kindness, because you don't fully know their story. Let me just minimize this. So here you can see that I've got a couple of examples, and I'll scroll through them quickly because I know that we're shorter on time, but I've taken on board your feedback from the WHO team as to what it's not just a health condition, it's also the environment and the barriers that come with that health condition that signifies a disability. So you can see here that I've updated some of these visualizations to show, for example, you've got bus drivers that may be suffering with or living with, depression, but they haven't sought help out of fear of the stigma that comes with a mental health condition. So you can see there are a couple of instances here. And so what I really wanted to do with those illustrations was to bring that kind of humanity to the story and set the scene for, you wouldn't essentially know who in your environment and in your neighborhood may be living with a disability, but just because you can't see it doesn't mean it doesn't exist. And that was kind of the basis that I wanted to lay before I jumped into the actual statistics and the data visualization itself. So in terms of the viz, I recognized that there was a lot of data to go through. So I know that we were looking at regional, low income, age, sex specific data, and I wanted to just hone in on one of those elements. And the element that I honed in on was sex. And that was because when it was a thing that kind of took me back when I looked at the data, was the sheer kind of disproportion in terms of women living with disabilities compared with men. And you can see that clearly from this chart here. And then I go through a couple of other stats that show how these causes of disability differ between men or female populations. And I also look at how those particular groups of aggregated diseases are actually split between men and women. And we can see here, when we actually look from a group perspective, that other non-communicable diseases, musculoskeletal and neurological, are all heavily skewed towards women. But we see down the bottom here that actually there is a huge skew towards men when it comes to substance use disorders. And I don't dive deeper into these, but I will quickly scroll through that. But if you get a moment, there are some interesting statistics that were pulled out from this piece of analysis. Following on from the more sex-specific data analysis, I wanted to look at severity, so how those particular causes of disability are being labelled as severe or moderate. And that was where I found a very interesting story, which was that for a lot of the causes of disability that are labelled as severe, I found that a lot of those particular causes were skewed towards men. So we can see in this extreme example here that for syphilis, we've got a 95% skew for men. So that was of the 14,000 or so cases that were reported, or estimated, I should say, 95% of them were categorized as severe, and 95% of the categorization was from men. And I thought this was really interesting because when I looked into this, 13 of the 17 that you see in this list did have a skew towards the male population, which I thought was quite an interesting statistic. So I guess the main kind of final thoughts that I had with this was that there is an additional sex and gender dimension that comes with looking at disability. And ultimately, we've shown that women are more likely to experience disability than their male counterparts. But also this interesting point that they're less likely to have their disability categorized as severe. And I just wanted to leave on that question, that is that because women's pain is underestimated, or is it more of a genetic and a biological thing? It's just food for thought, but an interesting piece that I wanted to call out. But yeah, I could go on. I apologise, I know that I've probably gone over the time, but this was a really interesting project to be a part of.
Thanks, Helen. It's amazing. Having you check the comment on the chat, people love, I love the design, the storytelling, the humanity you brought to talking about data, which I think is amazing. And I love the title as well. I don't know if people have picked the title, but yeah, amazing work. And we could listen to you for hours as well.
Thank you.
Next, we've got Jessica.
All right.
Jessica team,
all right. Can you see my screen?
Yes, we can, Jessica. All good.
Awesome. Let me just, okay, great. So to introduce myself, my name is Jess Wei. I am representing the DataViz specialty team at FCB Health. So I've got a number of team members on the line as well as around the room. We're really excited to see each other because normally we're pretty remote, but it's a happy reunion. And so what we do is we're a healthcare communications agency. So myself and David, who's sitting next to me, will be co-presenting. He'll roll on over when it's time. So first, I wanted to thank Viz for Social Good as well as the WHO for putting forth this challenge, because we thought it was a really amazing opportunity to address the WHO mission for this year, Health for All, and to do a deep dive into accessibility. So as you can see, the title of our submission is The Global Disability Landscape, Charting the Challenges of Mental Health. And this first section is an overview of our approach. So when we reviewed the disability data report, there was a lot to unpack, but what really struck our team was the enormous impact of mental health disorders, which is our area of focus. And to make an accessible data viz, we wanted to tell a very concrete story. So we decided to use a visual metaphor of a mountain to represent that magnitude of disability. All of these mountains then form a disability landscape, which makes disability a very tangible concept that can be measured, compared, and deeply explored. For example, later on, you'll see that the height of the mountains will measure prevalence. An overhead topographic view looks at risk ratios. Really, it helps us to tell that data story with a consistent visual language across all of these different angles. And finally, we do have some notes about our design considerations for generating a data viz that's compliant with web accessibility standards. I do want to make a note that, like C, we did use Figma for this final deliverable. Initially, we used Excel and Tableau to like deep dive into the data, and there was so much going on. But then eventually we landed on our main points, brought some design to Illustrator, and then that was pulled through in Figma. So let's get started. So here's where we start with a massive worldwide challenge. We've mapped out the global prevalence data to envision the scale and types of disability across the world in these mountain ranges. We primarily focus on the mountains of the top 3 health conditions, with their sizes representing the overall prevalence. And you can see how these range across the world. Furthermore, on the right side of the page, we put into context that it's 16.6% of the population, or the 1 in 6 people, which you've seen visualized beautifully across the previous projects. But this really gives you a sense of the scale that, you know, health conditions due to disability truly is a global health issue. All right, now we pull back a bit from the view of the map and we focus on the 3 health conditions that have the highest cause of disability. And for us, we were really surprised to see that mental health or mental disorders was second only to musculoskeletal disorders. So I think it's sort of like how Christina has said before, like the visible versus the invisible, right? The fact that, you know, disability is primarily thought of maybe due to outwardly physical causes that you can see, but really mental disorders can be quite disabling. And so a view from the top, and I'll roll on over and let David go.
Hello, everyone. So continuing this data viz journey or story, want to continue interrogating the data and see what else it could show us and how we can visualize it, right? So diving deeper into these categories, we calculated the relative risk for this disability. Our wonderful biostatistician, also named David, not myself, calculated this for us and was able to, and we were able to visualize it with these radiographs, right, or that you see over here. And it's almost like, you know, in continuing with the theme in the mountains, it's like you're looking at from the top, from these mountain tops. And what jumps out at you based on these is not only that it is also very prevalent across these various disability or causes of disabilities and the mental disorders, neurological disorders, and musculoskeletal disorders. But when you sort of look at the shape, you take a look at based on the shape, we can see that the mental disorders and the musculoskeletal disorders sort of have a higher impact on disability. Going one level even deeper, as many of the teams have already shown very well, that there is a discrepancy in terms of gender, right? And we find that women are more heavily affected by that. And the way we chose to visualize it here across not only the various different regions, but diving deeper into the mental disorder specifically, we find that, as you can see here by the mountains, that again, prevalence and that it's spread across all the various regions, but also that the higher affected the group is our women here. And finally, our sort of message and which, you know, it's sort of the theme of today and what we sort of, you know, which we really believe heavily in is sort of the call to action and the sort of rising to this challenge, right? That it's time for more and enhanced mental health policies across the world. And what you see on the left is we've taken some of the data there in terms of how many countries would have a national mental health policy. And you see that from 2014, it's grown to 2020 from 77% to 86%. However, this is great. This is wonderful. It's been an achievement. However, there is still work to be done because we're not at 100%, right? And as we've sort of been focusing on today, is that this is the people affected by this is whether visible or invisible. It can be a lot to deal with. So we need to hopefully get to that 100%, and there's still room for improvement for us for the more equitable and healthy future.
Yes. And that concludes our presentation.
Thanks, Jessica. Amazing work, amazing design. Those 5 projects have been really amazing. Piotr, we've got few minutes. If I don't mind being over time, I think it's such a rich kind of discussion. I think it's worth staying over for a few more minutes. But I understand it's recorded. But
yes,
I
would say, yeah, definitely. Thank you. Yeah, thank you again. I'd like to extend my heartfelt and congratulations to all participants. And I would like to invite Dorothy and Kyla. So I think if we can a little bit extend for 2 questions and make a little bit of panel. So Dorothy, Kyla, if you could join and ask the first question for our lovely top 5.
They were really, really good entries, and it was really difficult to judge among the many entries, but these were the best. So, and the focus on disability and data visualization, we'd like to understand what challenges you have encountered in producing this to be digitally accessible, because there's so many conditions there that make it difficult for people to access this data visualization. So how did you approach your production of the data the design and the production of the data visualization to make it digitally accessible for the people with disabilities? That's a general question for the 5 of you. And I think one of you had covered that in the presentation somewhat, but maybe we can do it in sequence, in the same sequence as how you presented the presentations.
Okay.
Yes, first last, yeah, please.
Hi. So regarding the accessibility, I have chosen 2 types of charts that are relatively more effective in making the readers perceive them, bubble charts and bar charts. And I also added a few indicators and sequential information to help better understand what is conveyed. In my data visualization, I have made some attempts such as selecting appropriate background and object colors and ensuring they all pass at least WCAG AA contrast. I also added alternative text to images and also added patterns to the graph to help colorblind people better perceive the charts. I think that's my my toolkit for improving accessibility. So I think there's something I can do more is to make the site more kind of like a screen reader friendly, because I use Figma, and Figma is like not a real website. So I think I will use pay more attention to the structure of the page when I implement it into a website, so that all the key information is recognized by the screen reader as much as possible. Yeah, that was my answer.
Thank you. Perfect. Maybe I will hand over to Christina. I don't know, Christina, are you still there?
Yes, I'm here. I'm sorry. Yes, as I said, I used simple charts, contrast colors for charts, labels for each chart, explanation for each chart. So, and I wanted to focus on story, not on charts. That's, I think, that my general objective was.
Yeah, thank you. A lovely answer. Gabriela.
So I think one potential weakness of my the way I chose to visualize the data is that these are very tiny points, and people with visual impairments may struggle to see those. So I made sure that that wasn't the only encoding. So if you can only perceive kind of the shapes as a whole, that also encodes the data. So that's not essential for the story at all. And then, as others have mentioned, color was a really big consideration. I did check with different tools for simulating color blindness, or and also just checking in black and white that the hues all worked, but I didn't want to depend on that. So any colors that are compared to each other are also distinguished by lightness. So that way, if the hues end up looking the same, they're going to be a different shade, basically, so that you can still tell them apart. And then also there's physical, I guess, shapes that distinguish different statistics as well. So all my bars have a line at the different divisions, so that it's very easy to see what the different sections are, even if you can't perceive the colors that well. And then another big thing that I did, I'm been really interested in topography recently and learning more about it, but hadn't studied it from the perspective of accessibility yet. So I learned a lot about how just the way that letter forms are shaped impacts accessibility. So that was really interesting. And I found a typeface called Atkinson Hyperlegible that was actually designed by the Braille Institute to be accessible for people with low vision, but it's also still very aesthetically pleasing and isn't distracting for people that don't have vision issues. So it's great to use for these types of visualizations that need to be accessible for everyone. So there's things like open counter, so like the space of a C. If we have a C like this, it can easily be confused for an O perhaps, but if it's like this, it's very obviously a C. Things like that. They paid a lot of attention to distinguishing things like I's from L's and capital I's. So that was a cool find, and I used that for all the text. I think one disadvantage of using R was that it is a static visualization, so that again, like C said, I can't use a screen reader with this visualization, but that's one of the reasons I kept it very simple, so that the alt text and maybe text around the visualization can at least cover those essential points, so that the data at least is accessible.
Yeah, I really love the typeface that you mentioned. I recently even the testing this one, so there is also a few more. So perhaps we can post it and somewhere on the social media, or I will send through Frederick if you want to a little bit learn about the typeface and the typography. Thank you, Gabriel. Ellen.
Yeah, so I touched quite a bit about this in the presentation. But yeah, the main thing that I was focusing on were, like I said, making sure that the color palette was accessible as possible for those with color blindness, and testing it actually for all of the top 3 most common forms of color blindness, contrast checkers and alt text info not dependent on color, that kind of thing. I guess one thing that I did want to say was that usually the data viz project in itself it's a labor-intensive exercise. There's a lot of work that goes into it. You're going through data sets, you're visualizing things and trying to find that story. And I was just kind of blown away at how much goes into making websites accessible, and all of the thought processes and the tools that have been designed for that. And I think I probably spent about 50 amount of my time, one on digital accessibility and then one on the actual data viz and the storytelling itself. It was really interesting experience, and one that I'm hoping to kind of pull through in all of the other pieces that I do.
Yeah, thank you for these remarks. And yes, the time is needed to explain the story and prepare something that will be both the beautiful and also accessible on the other hand, and still there is a plenty of the tools, and the tools sometimes don't help us too much in achieving this. Thank you. And Jessica.
Hi there. For this question of accessibility, I'll turn it over to our designer for the project, Arhian, who's on the line.
Okay. Lucky you.
Yes, that's me. I hope you can hear me. I'm Arjen. I'm a data viz specialist for the team, and I'm based in Amsterdam here in Holland. As we were developing our data visualization, we were purposeful in our use of shapes and sizes and colors and positioning to facilitate the comprehension of the overall piece. And we were really looking for a design that was colorblind friendly, but not purely dependent on the use of color. So we did a lot of cross-checking of our work with all the web accessibility standard, the WCAG 2.1 standards to facilitate our design decisions. And of course, the many resources and tools that were provided to us by Viz for Social Good team have been very useful here. And for those with visual impairment, we have provided text descriptions alongside each frame, facilitating readability and overall understandability. Some of the things that we had on our wish lists were a more mobile specific or responsive website design use, as we have seen in some of the other submissions. Alt text for images, of course, and a light and a dark mode toggle switch to contrast to provide more contrast when this would be necessary. So that's us. That's me.
Thank you. Brilliant. So let's maybe the last question, and we will finish. So Kyla, if you could shoot the question that we will ask our guest.
Sure. Thank you, Piotr. I was just interested for all of you to tell us what advice would you give to others that are looking to create accessible dashboards or visualizations based on your experience, specifically working on the topic of disability. Maybe we can follow the same order of answering the questions as before.
Hi. I think it would be beneficial to ask and learn from some readers, with disability probably, about the difficulties they have encountered when reading data visualizations and what they believe could be done to assist them in overcoming those difficulties. Because I think in general, first-hand feedback from direct users is the most valuable information. Yeah, thanks.
Thank you, Christina.
I would like to say just start doing something, because it's a good thing to create accessible visualization or dashboard, and don't forget about people with color blindness, low vision, epilepsy or mobility limitation, mental condition. So
yeah, thank you, Christina. And Gabriela?
So I agree with all the suggestions, but I'll also add, I think Ellen touched on this in the last response, that there's so much research that goes into accessibility and it takes up a lot of time. So I would recommend when you're starting out to work with your strengths in the other regards. So maybe use a tool you're familiar with, a type of visualization that you're comfortable with, so that you can focus on the new parts that you're not as familiar with, like accessibility. And it's also fine to limit yourself to smaller viz too, to start out with. And that's one of the reasons I stuck with a simple viz is I didn't need to worry about putting as much text on and making sure everything was a large size. I had room for the text to be larger and didn't need to juggle as many pieces in my visualization. So just as someone who's starting out with learning some new concepts, that was really helpful.
Thank you, Ellen.
Yeah, I definitely echo that. And I think that I would say accessibility shouldn't be an afterthought. rather than creating a data visualization and then going through, oh, my checklist of what do I need to include here, it needs to be a conversation that we have at the early stages of a design of a website or a product, because otherwise you end up with a hybrid or a patchworked piece rather than kind of a well thought out and structured idea where kind of inclusion really is kind of central to the work that you're doing. Yeah, that would probably be the main thing that I would stress.
Thank you, and Jessica and the team.
Wow, lots of really great points that were already covered, but I will turn to Ripley to answer.
Hello, I'm a data visualization specialist who helped out with the project. And I echo what everyone else said, especially what Ellen was saying about considering it from the very beginning, since it can be a very time-consuming process. And then also just consulting outside recommendations and resources. There's a lot of information out there. There's probably even online courses dedicated to it. So don't be afraid to get in and do some research.
Lovely. So that was all. I would like to again thank you for your work. That was a really good job. And from my perspective, what I would also recommend, start a conversation with the people who we building this. So building this application. Have a discussion or conversation with the disabled people and show them the chart, and even ask them, try it, use the screen readers and tell me what you hearing. It's a make sense for you or doesn't make it make an impact for all of us. So again, guys, from my perspective of the WHO representation, I would say well done, good job. And what I wish, continue the work and inspire others in this quest for better world, for better tomorrow. And Fredrik, I'm hand over to you.
Thanks, Piotr and the team. And to close, I've got only a couple of slides to close up, but on behalf of the whole Visual Social Good crew, thanks to the 5 volunteers that presented today. I know it's a lot of work, it's a bit stressful. Thanks to the 44 others that submitted as well. As Ellen said, we spend a lot of time doing those things and we try to understand the data and then we care. Also, big thanks for the WHO team. You've been super supportive, more than happy to share your knowledge and your inspire us, I guess. We often or sometimes do repeat projects. So if you guys are interested to do another project, maybe next year, if the volunteers are keen as well, I think we'll be more happy to accommodate another project for next year, potentially, maybe on a different topic. I just want to share my screen. I've got 2 slides before we wrap up. I just wanted to announce the next project that's coming up actually this week. So we're kicking off the next project. Not stopping. Usually we run project every 6 to 8 weeks. This one is just back to back. So we've got a couple of projects for the Northern Hemisphere summer. This one is with Gordoni Chani Yenak Fund. DWF, I think it's probably easier to say. Based in Canada. Their focus is on enabling Indigenous kids from Canada, education and health. It will be an amazing project. Yeah, completely different data set, as you can imagine, but a much more organization in Charlie as well. But I'll invite you to join. Just go on the Visual Social Good website. I can send a follow-up link. We keep connected on Slack as well. So Slack is probably the best spot if you want to connect with Piotr and the team and us as well. Sign up as a volunteer from our website and you'll hear from the next project. The last slide I want to also show is we are a non-for-profit ourselves. We all volunteers, we all have their jobs. So thanks to Vanita, she's our exec director. She's probably on the call. We had Eda, Kevin, Adrian, Imbol, all from Visual. We all volunteers. We love running those community events. But we also have a few costs associated with buying Zoom or website. So if you know Bill Gates or someone very rich that's being willing to give us some money, we'd be happy to accept a small donation and then get Visual Social Good going. I think it's important for us to we're not asking for much, but if you know someone that's willing to donate to our cause, we can bring more of those projects together. But that's all I had to say. Thanks a lot. If I don't know if anyone from the board, from Be Social Good, or the community has something to say, but otherwise I'd be happy to wrap the project. I'll send an email follow up with a recording if you had colleagues that missed the event. But again, thanks everyone, and then maybe we see you on Slack and maybe online some other time. I'm happy to stick around for a few comments, but thanks again.
Thanks, everyone.
Thank you. Bye-bye. Have a nice day.
Thank you very much. Bye. Great work. Thank you.